From pediatrics for Milwaukee's children to primary care for its adults, a community health agency such as Milwaukee Health Systems is one example of cooperative efforts underway in the city to improve access to health care. This private, nonprofit organization offers one-stop health care in a north side area of the city with what's called a medically underserved population.
Milwaukee Health Services is a community health center. It's been in operation in Milwaukee for 11 years. Last year we celebrated our 10 years of providing services. We provide comprehensive health care to people who live in inner city North Milwaukee. It's our main target area, but we serve people from throughout the state. We serve about 18,500 plus people per year in multi-levels of service.
COG's Community Health Center is one of the system's clinics, a city-owned building funded by federal money and other grants, many services paid for by the county and state-funded General Assistance Medical Program.
I think the goal of Isaac COGS and Milwaukee Health Services as a corporation is 100% access and 0% disparity. Having said that, the scope of services that we provide is fairly comprehensive, starting from primary care, internal medicine, obstetrics and gynecology, cardiology, podiatry, diabetic health care, and also HIV care, both from a preventative point of view and also from the care point of view. And also medical nutrition and nutritional counseling. So that's the scope of the spectrum of services that Isaac COG's Health Connection offers, besides inpatient care at St. Mary's and Columbia Hospital.
The laboratory at COG's Community Health Center plays an important role in the diagnosis of HIV infection, and the clinic helps those who develop AIDS. Janet Glazer is the HIV Services Coordinator.
Coordinate a very unique program called the Title III program, which is part of the Ryan White Care Act, which provides health care coverage, all sorts of insurance coverage for people who are HIV positive and can't afford to pay for their medicines or their health care needs. We serve currently approximately 300 HIV positive people right here between Isaac COGS and the MLK Center, which is also part of Milwaukee Health Services. And we're part of a cooperative grant. The Title III grant has services not only here in MLK, but at the 16th Street Community Health Center and at the Johnston Street Community Health Center and the Mitchell Point Center. So we are one, but we are many. We are a big cooperative effort. We also cooperate on many different levels with the AIDS Resource Center of Wisconsin, with Milwaukee Medical College, with Froedtert Hospital's Infectious Disease Clinic. There is a program for pediatric HIV in this state that's run by the Children's Hospital Group. We collaborate with them. In fact, if we have an adolescent with HIV, their doctor, Dr. Peter Havens, comes and sees them here at our clinic so they don't have to travel to the west side, because a lot of people don't have enough money for even bus fare. So we figure if we can get them here, we can take care of them here. That's a good thing.
MLK Heritage is another Milwaukee Health System site serving residents of this Northside neighborhood. Pediatric services are among the medical, dental, and behavioral health services offered by the clinic to people who might not otherwise have access to health care.
MLK is a very unique center in that it's very underserved. When I say underserved, most of our patients don't have insurance. And sometimes our patients who don't qualify for Title 19 or Medicaid, sometimes they're just right over the means, so they actually have to self-pay. And this is very hard for them to do. So our center actually acts as a cushion, as a buffer to help them make them possible to see a doctor. As a pediatrician, one of the first and foremost goals is to make sure all our kids are immunized. Our kids have high lead levels, so monitoring and tracking these kids is of a particular importance. So these are two of the things we're trying to achieve.
The goal of this agency was to create not just a medical service, but so much like a mini mall for shopping, where you can go and get, your groceries and go to the drugstore. Whereas here you can come if you need X-rays, physical therapy, any type of service. We have it within 5 blocks of one another at these two facilities. The number of services we provide, the rate of service which we charge for these services, and seeing people on sliding scale fees when they're underinsured or uninsured, they would be hard-pressed to go other places and pay out of pocket for the types of services that we do, and also the type of understanding that we have of the client base that we serve.
As we've heard, Milwaukee Health Services is working with many others in the community, and staff members support those partnerships.
It really is a challenging and a daunting task, and it involves interventions at multiple levels, multiple levels, and above all, it needs highly dedicated and committed people wanting to provide care to the uninsured and the underinsured.
I think it's hugely important because there's limited resources so far as money is concerned, and many smaller social service agencies, for example, do a really good job at what they do, but they don't have the money to reach as many people as they could. And through collaborative efforts, the wealth is shared and the services can be spread farther in the city and more people can be served.
I think a lot of the problem is our patients don't have a way to get here. So I think providing transportation so our patients can get here is a big thing. A lot of our parents and our kids are not educated that we're even here. So for them to get the word that, yes, we are here and we will accept them if they come, that needs to be done too. As far as working with other agencies, we work with WIC. In fact, we have a WIC office right downstairs. We get a lot of referrals from homeless shelters. We go to Head Starts. We're united with a couple of YMCAs and YWCAs. So we're joined with many other underserved communities and centers.
The art of collaboration is something that's not lost on a lot of people who try to do it every day. Smaller agencies such as ours and medium-sized agencies, Milwaukee Health Services has tried diligently to collaborate with anybody who will open their doors with us to provide seamless service and care, such as hospitals. If a patient goes from us, that care should be seamless going to a facility where they're going to be inpatient.
Milwaukee Health Services was one of many health providers taking part in a recent community forum on health.
It's an absolute pleasure to welcome all of you here to the first ever Urban Health Conference in the greater Milwaukee area, and I'm extremely pleased to see such a great turnout and such a great group of people from all over the Milwaukee area. Sponsors
of this forum, called Piecing Together a Healthy Community, included the City of Milwaukee Common Council, the City Health Department, and the UWM School of Allied Health Professionals.
And while dialogue is good, action is better, and this event is meant to be a participatory forum where your expertise, your passion, your ideas are listened to and implemented. If you just look around this room, you'll see the talents and expertise and breadth of knowledge and background of individuals are from all over the place, and it's incredible. And it's, I think, the first time probably ever that we've drew such a diverse group of people together to talk about health issues. There's a tremendous opportunity here today to establish an ongoing dialogue and strategic partnerships which will make healthcare accessible, comprehensive, of the highest quality, and prevention-oriented, and that's really our overall goal. From the Economic Summit held in Milwaukee last November, the single largest private employer and the fastest growing industry in southeastern Wisconsin was identified as the healthcare industry. And the greatest impact on our economy in Milwaukee is education and healthcare. Investments up front in both of these areas bring many returns down the road. And we have an opportunity to serve as a national model for the country in terms of combining our resources, maximizing our efficiencies, and developing collaborations that create what will be, I think, a united healthcare effort.
That united effort isn't always easy, with competing factions within the healthcare community. The forum brought together public health officials, healthcare providers, administrators and health educators, hospital and clinic staff. There were social workers and providers, teachers, researchers, health insurance providers, policymakers, and concerned citizens from throughout southeast Wisconsin. The forum's keynote speaker acknowledged how difficult it can be for everyone, and he attempted to motivate the diverse organizations by saying all could learn from the animal kingdom.
One of the favorite parallels I use relates to geese flying in the V formation. You've seen that. But there are many lessons from that, because as each goose flaps its wings, it creates a lift for the geese that follow. And by flying in a V formation, they can go 71% greater distance than each goose flying alone. And the message is clear from that people who share a common direction and a common goal can go a lot further working together and can get there a lot quicker. Whenever one of the geese gets out of formation, it experiences drag and quickly gets back in formation. The lesson there is it is much more difficult to do things individually than when working together. When the lead goose gets tired, it rotates and gets back into formation, and another goose takes the lead. The lesson there is shared leadership. We have to give everyone an opportunity to lead as well as an opportunity to follow, because that gives the leaders an opportunity to rest. The geese flying in the rear of the formation, when you hear them honking, they are honking to give encouragement to the geese in front. How often in life is our honking not meant as encouragement, but as discouragement? When a goose gets sick or wounded, 2 geese drop out of formation and stay with the sick or wounded goose until it either gets well or it dies before they try to join another formation. The message is we have to pause periodically. For our colleagues, we all need help periodically. Standing by each other in difficult times is extremely important. Lessons from the geese.
That is neighborhood-based, that is there when you need it, and that we've made great strides as a community ensuring our community over the last few years with a great deal of work, making up some of the ground we lost in the early days of welfare reform. Now it's time to ask ourselves, is the care that we are buying truly prevention-oriented, truly comprehensive, truly linked, truly communicating with itself? The second major lever is to be supportive all around the community. Mass media, health department, employers, faith community, your doctor, your nurse, your school, in supporting healthy behavior choices. Environment is one of the themes, but how can we address a healthy environment, particularly the residential environment, when we see that lead, asthma, injuries, and violence in the home are leading causes of death and disability in our community? How can we deal with creating healthy residential environments using the tools of a prevention-oriented healthcare system and using the tools of community-based health promotion and wellness? Communications. How do we make our healthcare system more communicative, more interactive with people? We are hearing that it is not sufficiently so. And how will our health promotion work truly meet its target? Reproductive and sexual health could not be stressed enough. As a community, when you look at our performance, we are failing pretty significantly in the areas of making sure that our youth and our adults are free of sexually transmitted infection. We are failing rather significantly in making sure that pregnancies are intended and not unintended. Our unintended pregnancy rate is almost twice that of the state of Wisconsin. And we are failing fairly significantly in trying to accelerate the pace of decline in teen pregnancy in our community. It is going down, but not as fast as many of our other communities. Children's health, if we were going to pick one lever, we know children's health is enormously important, but if we're going to pick one lever, it would be supporting parents and guardians to know that they have the tools, to know what they need to do to make sure that their children are healthy and that they have the resources to do it with. And finally, addressing really startling gaps in our care system. One of these, for example, is health care for children in foster care. It's a large community, it's a high-risk community, and we know that our current systems of insurance and health care provision and health promotion often let those children fall through the gap.
There are many examples of cooperative efforts in the city to improve access to health care. The Fetal Infant Mortality Project includes the City Health Department, Black Health Coalition, Children's Hospital, and the Latino Health Organization. Making sure infants get proper foods is the goal of the Women, Infants, and Children program operating in many health centers, usually funded by the Department of Agriculture. Women and children with high health risks and in need of social services are helped through the efforts of many agencies in the Milwaukee Family Project. When it heats up, the Milwaukee Heat Task Force gets together. The Health Department, Red Cross, County Office on Aging, Salvation Army, Weather Service, and others. The 16th Street Community Health Center works with the Health Department on prevention of lead poisoning and other environmental issues such as air quality as it relates to asthma. At the city's Lapham Park Public Housing Development, Milwaukee County, Set Ministries, St. Mary's Hospital, and Housing Authority work together to help the residents. Forum participants looked at ways to include ethnicity, culture, and language as integral elements of healthcare education and promotion. How the community might ensure that homes and neighborhoods are safe and hazard-free. There were discussions on family planning, helping parents meet children's developmental and health needs, how to make sure that health services are continuous and linked, regardless of changes in life circumstances or health needs. Healthcare providers say the ongoing strategic partnerships are essential to improving the community's health.
Well, Milwaukee County really does two things as it relates to access. One is we run the county paramedic program, and while that program absolutely serves people in critical needs of help, too often people use that as a system, as a way to access health care. So that's a big issue for us as to how to make sure our paramedic resources are saved for the times when we need to be saving lives. So that's one of our issues. The other thing that Milwaukee County does is run the General Assistance Medical Program. Healthcare access occurs for many people through that system. So any way that we can expand our program, any way that we can partner with other people to get the benefits of our program coupled with other people's is a great thing for our patients. And once the closure of the county hospital occurred, then we went into public-private partnerships. So we're really interested in expanding our public partnerships.
There is a decreasing capacity for walk-in care, especially in certain pockets of Milwaukee County, where people are waiting for days and days and days to get to see their primary care physician. And so they end up in the hospital emergency department, which is a very inappropriate place for primary clinical care. And not only that, but the expense is extremely high. So loss of capacity and access for particularly a self-pay population and uninsured population, basically anybody that is connected with a community clinic or a hospital outpatient center, the wait is very long. So second thing that brings hospitals to the table is that we really want to develop partnerships, continue to develop strong partnerships with community providers and other community organizations and begin to say, you know, what can we do together to help people? This is really a social justice issue. I really believe that justice is a matter of the company we keep and who we can tolerate excluding. And from the hospital's point of view, we're getting to the point where we don't want to exclude anyone. We want to offer high-quality healthcare services to everyone, irregardless of ability to pay. It's becoming harder and harder to do that from a funding stream point of view, from both the public and private payer sources. So we want to partner to see if we can begin to offer and find some solutions to this challenging issue of access.
Well, first of all, I think it's important to understand that in many ways Milwaukee is a very resource-rich community when it comes to healthcare providers and organizations and healthcare systems. We have a relatively small geographical area, and we have many hospitals, we have many healthcare organizations and community clinics. We have social service agencies that provide many health-related type programs and health education programs. So we have the positive aspects is that we're rich in resources. I think what we need to do is to find a way to improve the access into those resources for those that are most in need. And much of that comes through education. These organizations have to be working together in a partnership to help reach out to the community, particularly to those consumers who do not understand how to get into the healthcare system until it's too late and they have a medical emergency. And then secondly, once they're in that system, help them to understand how it's in their best interest to stay there, get the preventative care so as not to allow a medical crisis to develop. For the Medical College of Wisconsin, we're a part of this community. Some people think we only provide research and education in terms of producing physicians for the future, but we're also a very vibrant part of the healthcare delivery system in the clinical service side. We operate clinics in the community. Our physicians and our health educators are in the community in public housing sites, and so it's very appropriate that our hometown medical college be a part of an initiative like this in terms of trying to move to a healthier community in the 21st century.
The forum that we're taking part in today, I think, is a good start of the areas that we need to look at as far as the accessibility of comprehensive preventive health care for the city of Milwaukee residents. But I'm going to play devil's advocate. Maybe we should look at having a forum where we invite the people in the community to come together to tell us what they think the problems are and come up with some solutions. We need to go to where our clients and patients are, in the beauty salons, in the barbershops, in the schools, in the churches, in the malls. We need to really start having dialogue with the people in the community. Many times we spend so much energy coming up with programs and strategy solutions for problems that many times we're not even dealing with if we're not a consumer. And all of us are consumers of health services, and becomes a major issue when we are on the receiving end of services and it's so complex. I think we need to make our system less complex and more comprehensive, pulling together all the resources. We look around, if we take a map of everything that is involved with the people that are here today, take a map and put it all together. It's complex. How can we make it simple for the consumer and also simple for us, because it will make our jobs easier as healthcare providers, whether it's from the social service end or direct service care or delivery.
One of our concerns always is the cost of programs, and certainly we know that as far as healthcare is concerned, the costs are escalating very rapidly. So this conference I feel will be helpful from the standpoint of bringing people together who perhaps are providing the same or overlapping services, and allow them to work together in a more efficient, coordinated way to not only save money but also to provide better services. And in addition, I think that we need to emphasize something that's very difficult for all of us, and that's living a healthier lifestyle. Because, for example, take smoking. If we were able to eliminate smoking among our entire population, we'd save maybe as much as 1/3 of what we're spending today on health care. So that, of course, requires a little bit of participation on the part of every one of us, because that does not come easy. But I think if we're going to ultimately solve the situation that we're in today, it's going to require participation on the part of all the citizens, and government cannot solve all the problems of everybody. It requires some personal participation.
The summit meeting on healthcare issues in the community involved nearly 300 people involved in public health. Getting all the key players in the community involved in improving health will continue to be an ongoing issue. Participants were told they have a tremendous opportunity to find novel solutions to long-term problems.
What happens in Milwaukee does impact the state and affects the nation and the globe. Several months ago, you may have read that the Institute of Medicine in Washington reported that the nation's health system is a tangled maze and needs to be overhauled in the 21st century in order to bring more care to more people. Healthcare costs in Milwaukee rank in the top 25% of all U.S. cities. But like our Secretary for the Department of Health and Family Services stated, it's not really how much money you throw at an issue, but it's what you do with the money that you have. And we need to move to a balanced community healthcare system whereby healthcare providers, government, academia, the community all take responsibility for health promotion, disease prevention, early detection of disease, and improving access. It means really a coming together of public health and resources as they've never come together before. And I'm hoping that all of us in the room today will work towards that end. Prioritizing the right issues, identifying the key target risk factors, meaningful and measurable outcomes, plus developing linkages of accountability will ensure political buy-in, program commitment and dedication, as well as resource allocation towards improving health of the Milwaukee area.
This forum is designed to allow you to use your creativity to collectively reach solutions about the various issues. You are critical elements when it comes to these kinds of problems. Understand, we can go abroad to get TVs. We go abroad to get computers. We go abroad to get automobiles. We even go abroad to get space stations. But we cannot go abroad to get a health care system. That has to be homegrown. You have to provide that, and we depend upon you. You see, the true significance of this forum is not so much in what happens here as it is in what happens when you leave here because of what happened here.